Good afternoon. I'm John
Perfect.
Clymer, Executive Director of the National Forum for Heart Disease and Stroke Prevention, and we are delighted that you're joining us to learn and share about Move with the Mayor mental health and physical activity initiative. Special thanks to our alumni mayors and cities who are returning, and a warm welcome to those who are new to Move with the Mayor. Today, you're going to learn about how Move with the Mayor works, what to expect, and what you will gain from participating. We're going to hear firsthand from Mayors Rachel Proctor of DeSoto, Texas, and Quentin Hart of Waterloo, Iowa, about their experiences in Move with the Mayor. And at the end of the call, you will have an opportunity to ask questions as well as to share what you're planning in your community. This meeting is being recorded, which will enable you to catch the playback. Move with the Mayor is celebrating a decade of impact. Mayors across the country are using Move with the Mayor to promote physical activity, social connection, mental health, and overall well-being in their communities. The initiative serves as a catalyst for community engagement and public health by motivating residents to participate in physical activities while building social connections. By uniting local governments, organizations, and residents, Move with the Mayor fosters partnership-driven initiatives that contribute to improving community health. It's a powerful vehicle for mayors to lead by example in showing the importance of healthy living while addressing health disparities within the community.
So far, 39 cities across the U.S. representing geographic, racial, and political diversity have committed to participate in the Mental Health and Physical Activity Challenge. If you're tuning in for the first time today to learn more, we hope that you'll join as well. It's my pleasure to introduce our spotlight speakers, both of whom are actively engaged in Move with the Mayor and committed to the health and well-being of their community members. Please help me welcome Mayor Rachel Proctor of DeSoto, Texas, and Mayor Quentin Hart of Waterloo, Iowa, to share why they've made health a priority, as well as their experiences in Move with the Mayor.
Thank you so much, Jen, and thank you for all your efforts and work that you do. And Mayor Proctor, that's incredible examples of health resiliency. So thank you so much. But Mayor Quentin Hart, City of Waterloo, Iowa, and one of the first reasons that I wanted to be a part of, other than Jen is does such an incredible job talking about the program, is that several years ago, there was a report about obesity rates and asthma rates within our local community. And so, from just an overall perspective of health and well being, I think it's important for mayors and for everyone to come together to try to help conquer and challenge some of those rates. And if you take a look at it, health, if there's anything that we can rally for, that is just health of our communities. There's not a Republican issue, not a Democratic issue, an independent issue, just working for health helps improve our entire community. And so in the last couple of years, we've been fortunate to start a couple different things that we're doing locally. And one is called the Mayor's Pump and Run event. And the good thing about it, it's a 5K. But that Friday before the Saturday, the 27th, when we actually do this, we actually get to do curls and do some bench pressing, and that actually lowers your time frame on your 5K run. If not, so if you see a very fast time, that means I've been doing a lot of curls and stuff to try to make that happen. But it's one that you go through our Cedar Valley Sportsplex. There's a number of different partners that are available that are helping us work through this as well. Another event that I'm very proud to talk about is the Live Healthy Iowa Kids Track Championship that will be held in May. And it's children throughout the community, throughout the state that are coming here and trying to compete and work hard with regards to track and field. And one of the reasons that this is such a good program, because we know there's a lot of video games, we know there's a lot of social media that we sit behind a television or a phone, but this is an opportunity to actually get kids up and running as well. Another event that happens a little bit later is our Mayor mayor's annual fun run. It's where every fourth grader in the entire city run against the mayor for about 1.5 miles throughout our downtown, which is really great. And I'll say last but not least, yes, move with the mayor, and that's good, but also during this same time period, since we've been members, there's really been an emphasis on mental health as well. And our Mayor's Youth Council has been able to tackle some of those issues. On the back of every student ID card, this was just done in the last 2 years, there is a barcode on there where if you scan it with the phone, you'll be able to see different mental health services that are offered through our K through 12. This Mayor's Youth Group has also won a regional Emmy for their PSAs that they've given out to the local community. So from health to mental health, our partnership with Move with the Mayor has really been able to help us realize some of the benefits of health, physical, and mental as well. So thank you for all you're doing as well.
That's incredible, Mayor Hart. Thanks so much for sharing that. I love the idea on the back of the cards. That's awesome. So many thanks to Mayors Proctor and Hart for sharing more about what you're doing in your communities and for your leadership and commitment. This is exciting. And Mayor Hart, if you don't mind popping your social media handles into the chat so others can follow. You do a great job as well of posting all of the great activities that you're doing and engagement in your community. So this is so exciting.
We have time for some questions and answers. Mayors Proctor and Mayor Hart, thank you for your presentations. It's really exciting, really inspiring to hear what you're doing in DeSoto and Waterloo. Mayors Proctor and Hart, I'll start with you. What are your goals for the Spring Challenge? What are you hoping to accomplish? And I guess most importantly, what are you wanting to change for your communities? Since Mayor Proctor started with the comments, Mayor Hart, why don't you lead off here?
Well, first I want to finish. I'm trying to finish, right? It took me a while last year. So, I'm trying to put myself in the best shape for my local community as well. But just also continue to change the culture around the thoughts about health and about getting out walking or getting out running, but just change the overall culture that we may have with regards to doing that. We both know that, all of us know that, improved physical health is good for a healthy community. It increases the amount of people that connect with one another when you're out and about and you're working with people. And a healthy community is a strong community as well. So just somewhat of the goals that I have.
And Mayor Hart, I know that in Iowa, you've made economic development and economic resilience for your community priorities. Certainly health equity or just equity across the board is a priority as well. How do you tie those things together, and how does Move with the Mayor help you do that?
Well, one, the incredible amount of resources and the information that you share across mayors. By bringing this all together, I just listened to Mayor Proctor and just came up with an idea or thought about what I may be able to do here locally. So bringing us all together, sharing best practices is number one. Number two, just the challenge that Mayor Proctor mentioned about just overall engagement. How do you increase those levels with the local community as well? So you're not just doing a pump and run by yourself, right? But how you increase the levels of engagement. And then number three, it's really making us think outside of the box, even with our parks and recs and our parks in different neighborhoods, right? How can we increase opportunity through structuring our parks differently so that we can continue just this conversation about physical health throughout the entire year as well. So this is an incredible jumpstart in helping us to make sure that we have the practices now, but that we continue them 365.
Excellent. Thank you. That's really instructive. And I love how you're picking up ideas right here in real time. And you're sharing ideas with each other. That's to me, one of the exciting things, one of the great dynamics.
Can I just say one thing
Please.
really quickly? I
Please.
know we're on a time schedule, but just like the conversation about having walking meetings, we will have a meeting inside this building during the summer to talk about a portion of our wrecks and trails. Why not just getting out and going over to that portion we're talking about to look at it, use it. You know, we talk about our bike lane. So we'll sit in the office, we'll talk about the different bike lanes that we're trying to do and never actually get outside to experience it at the same time. So this is changing my mindset on the way that I do things with staff and getting behind this computer and getting out into the streets to do some of these things.
Oh my gosh, that is exciting. Thank you for sharing that. Well, as you suggested, Mayor Hart, our time is up, and we need to draw this to a conclusion to be respectful of everybody's time. My gosh, we've sure learned a lot from both of you, Mayor Proctor, Mayor Hart. Thank you for sharing. Thanks to the National Forum team for sharing so much information. I am really excited to see the results that all of you mayors are able to achieve for and with your communities in the Spring Challenge. And we look forward to helping you publicize what you're doing and draw recognition and share more ideas with one another as the program continues. So thank you for joining this meeting, and thank you all for participating in Move with the Mayor. And with that, we are ready to move on to the next part of our day.